Hi to my Hispanic Chamber friends. I sure wish I could be with you today, especially so I could give a hug to Gloria Starling and a virtual hug to Gabriel. They have supported our efforts to raise awareness and funding for cancer care services. And as you know, they make an incredible team. And through them, I've had the joy of getting to know John Hernandez. And now John is serving on Cancer Care Services Board. So the Hispanic Chamber has given a lot to Cancer Care Services. And I really thank you of the gift of your time today. What a joy it is to share our mission with you, especially since this year is our 75th birthday. So, our mission is to support cancer patients, care for caregivers, and empower survivors because we want to reduce the impact of cancer in Tarrant County. So, this mission is very personal to me because I have been a cancer patient, I have been a caregiver, and now I am a survivor. When I was diagnosed with cancer, I was in my mid-30s and I had three little girls in elementary school. So it wasn't just traumatic for me, it was traumatic for my entire family, especially my children. And after my treatment ended, we really thought our family's cancer journey was over, but it wasn't. A few years later, my daughter Lauren was diagnosed with cancer, and soon after, my husband was also diagnosed. This photo will give you a glimpse into our lives. So, my husband now is a survivor like me, but sadly, my precious daughter is not. Lauren passed away 16 days after her 21st birthday, and my world was shattered. I honestly can't imagine going through that experience without my cancer care services family. Our social workers supported me not only during the 7 months of Lauren's life, but then during years of the grief after I lost my child to cancer. So my personal experience has shown me how meaningful and healing our work really is. So, the first thing I'd like you to know about our programs is that 100% of them are provided at zero cost to clients. The second thing I'd like you to know is that we serve everyone impacted by cancer in our community, all ages, all cancer types, all income levels. So, here's what we do. We support cancer patients by providing cancer navigation. So, this means we assess the specific needs of each person, and then we may help them pay for their health insurance or provide gas cards so they can get to treatment. We even provide nutritional supplements and counseling. And in response to COVID, we created a special emergency fund to help cancer patients with crisis needs like rent and groceries. We've spent over $81,000 in relief funds for clients who have suffered extreme losses during the pandemic, including paying rent for a single mom with 4 kids plus cancer. So, when it comes to caregivers, the stress of caring for a loved one with cancer is overwhelming. When I was caring for my daughter, Lauren, I was scared all the time. I felt helpless and I felt really alone. So now we have a social worker for caregivers. We also provide free counseling for children and adults who are caregivers, as well as a virtual caregiving class. And finally, we empower survivors. So cancer doesn't just magically disappear from your life after your last treatment, as I will know. Being a survivor has its own challenges. So we provide navigation and support for survivors as long as they need it. Some survivors need support for a year, some need support for a lifetime, and we're here for just as long as they need us. And remember how much we charge for all this support? That's right, zero. So cancer care services typically helps around 4,000 people a year. But since cancer screenings were paused in 2020 due to COVID, our client numbers were slightly lower. But that doesn't mean that fewer people had cancer. It means fewer people were diagnosed, and that's not good. So we expect to return to our normal client volume this year. Plus, we must be ready to serve those newly diagnosed patients who weren't screened last year in 2020. So, because cancer is the leading cause of death in Tarrant County, our work is really cut out for us. In order to meet the increased demand, cancer care service must grow. We need more social workers to provide free cancer navigation, especially in areas where resources are so scarce. We also need more community health workers. Their specialized training enables them to build a bridge of trust between marginalized communities and the considerable support they need, and we are ready to give them. Finally, we need more counselors to meet the mental health needs of cancer patients, caregivers, and survivors, especially these days. In a recent poll, nearly half of adults in the US reported that their mental health has been negatively impacted due to worry and stress over COVID, and I'm one of them. So imagine adding the trauma of cancer upon that. Countless things have changed in our world since 2020, and the needs of cancer patients and their families have multiplied as a result. So, Cancer Care Service has risen to the occasion by doing more for our clients, like spending more time with them and providing even more resources. So, if you or anyone you love ever hears those words, you have cancer, now you're going to know that Cancer Care Services is here, just like we've been here for 75 years. So, thanks again for your time today. I wish I could be with you all because it means a lot to me personally that you care. Thanks.